Hi, my name is John Stan and I am a doctor of traditional Chinese medicine. I've been practicing for 25 years. I'm also the president of Eastern Currents Distributing, and I would like to share with you today one of the latest and greatest developments in cupping therapy. Many of you are familiar with the traditional cups that are available in the market, the glass cups and the plastic cups with the pump to create the negative pressure. But today I'm going to talk to you about why the silicone cup now, for most techniques, is the new go-to tool for soft tissue release, for adhesion release, for moving cupping, for stationary cupping. This video is not intended to train you on how to do cupping. It's assuming that you already do know cupping, and it's intended for professionals to understand how these tools are different from the standard tools that are available. So I'm assuming that you know all the contraindications and so on with cupping, so I'm going to move forward and not talk about that. So with the glass cup or the plastic cup, we are limited to the fixed surface that is there. So one of the drawbacks is that whenever you move over a curved or bony surface, you're going to lose the negative pressure inside the cup, and that will now force you to reapply or limit your use to flatter areas and not crevice, bony areas. What's great about the silicone cups is not only do they provide a very comfortable edge versus the hard edge and the rather sort of stiff plastic edge of the plastic cups. The silicone cups are the medical grade silicone that stay very durable and maintain a very comfortable edge when moving along the surface of the skin. And the fact that you can morph the edge of the skin allows you to now get over very bony prominences and do areas of tissue that you normally would not be able to do with regular standard cups. So the first thing about the cups is that a lot of people get intrigued about them and they try them and they take them and they hold them like this and they push and they try to get a negative pressure that way. And for the most time, you get some pressure, but nowhere near what you would get with a glass or a plastic cup. And then practitioners will then, who have bought these, try them and say, well, they don't quite work enough, strong enough. So they go back to their traditional tools. But hopefully after today, you'll see how to use them and why they are significantly different and more appealing. So first of all, to apply the silicone cup, to make sure you are getting the maximum negative pressure, you need to put your two fingers underneath the edge, not too far forward, but just on the outside edge, and you put your thumb on top. Now, what you want to do is you want to take that far edge here and place it down and then flatten the cup out, and then just slide your other two fingers away, maintaining the pressure on the thumb, so that you will get a divot. And I don't know if you can see that. That divot here indicates that you've got the strongest pressure. And it'll be quite strong. So you can definitely create the same amount of pressure as you could with these by using this method. To release, you just put your fingers underneath and release. So if I do it on my hand, again, same thing. I'm flattening and pushing down, and you can see that there's this divot in here. I've got the strongest pressure. Now, if you're wanting to provide less pressure, then you just push with less force, and you don't see as much of a divot, and you get a strong suction. For patients that are older with more delicate skin, you may not want to go that strong because it could actually sort of pull blood out through the surface. So you can use another technique of squeezing the two sides together and then plunking it onto the tissue, and that way I get a nice mild pull. So now for stationary cupping, each cup produces a stronger pull. And so This small cup can be used for epicondylitis, it can be used for hand massage, it can be used for the sole of the feet, it can be used along various areas. You can figure that out yourself, but I'm going to kind of just show you some of the techniques on my forearm here. I'm going to use this Blue Poppy Sports Massage Oil. It's an apricot seed oil with some Chinese herbs in it, some frankincense, some myrrh to help promote, and cinnamon to help promote blood circulation. So here I've oiled and I've placed the silicone cup, and now you can see me pulling and creating that moving cupping phenomenon. So if I lose pressure, I can easily just reapply. Stationary cupping, I can just leave it like that, or I can do the moving cupping. Over bony surfaces like this, I can do a circular motion. And that allows me to get over various edges and things like that. So this circular motion, twisting motion like that, is another useful tool. But I also want to show you why these become a new industry standard is that working over an edge like this is very difficult. So if I apply the silicone cup, I can now morph it. See how I'm squeezing it together? And I can squeeze it along this edge and really pull the tissue into the attachment of the bone. If I lose pressure, I can easily apply it again, and I can work that edge very easily. So this is something you just can't do in standard cups. And work an edge, and that allows you to do something magnificent. So see, easily apply, plunk it on, move it around. I can pull tissue, and when you pull slowly, you have various techniques. When you pull slowly, you're allowing the fascia to separate, you're allowing for body fluids to go in there and regenerate and rejuvenate a particular area and help actually remodel that fascia there. And just look at that strength of that pull. It's very strong. And now watch as I sort of squeeze the edges together. I'm really getting it along this edge. So a very slow pull like this is very useful for really drawing in a regenerative blood supply and releasing adhesions and fascial pulls and congestion. Stationary cupping, just place it on and leave it there. You can use it for Dupuytren's contractures or other arthritic conditions of the hand. Just plunk it on, and for the hand, you're going to use this twisting motion again to work. It just feels really wonderful. You can sell these to your patients, and they can work the Dupuytren's contractions twice a day for 10 minutes, and it'll help release the fascial and adhesions there. But this kind of twisting motion, the sole of the foot or the hand, works very, very well. Now the different sizes can be used in different areas, and again, don't be tricked into thinking that this can only be used in this particular area, or this can only be used in the hip and the IT band area. But because the fact that you can do this, you can actually morph the shape and create a deep pull through many layers of fascia, because this large cup is super strong in its pull. And to apply this one, you'll need two hands. And you're going to use two fingers, and you're going to pull with your fingers, push with your thumbs, and you're actually going to flatten that out and plunk it down to get that pressure. And again, you've got that divot in there, which shows you've got the strongest pressure. And let me tell you, it's very strong, and you should be conscious about that when you're using it. But like I said, it can be used in various areas, and I'll have a model here shortly, and I'll just show you how to apply them, and just stationary cupping and moving cupping, and why this one is now my new best friend. Also, with the cups, we've found that it's versatile in the clinic. The soft edges are very comfortable to work with. You can use it stationary or moving. You can also instruct patients to do their own self-care at home with them. With a little bit of coaching, that becomes a very useful tool to help manage all kinds of conditions. For example, another practitioner gave me the tip that they keep these in their shower, and they soap their IT band or their knee, and then they just apply the cups with the soap and do the moving cupping daily, which is just continually freeing that fascia around the difficult areas, and has truly reduced their problems that they have with their IT band and their knee. In fact, we had another individual who was scheduled for knee surgery, and she was using this medium-sized cup over her knee daily, again with oil or soap, and just releasing that area on a constant basis helped bring the regenerative fluids into the area, reduce the inflammation, and she no longer needed knee surgery. So these guys are great. I know you'll love them. Again, just remember to apply it in the manner that I showed, and play with the morphing qualities of these, and you will never look back. In fact, I have 5 or 6 sets in my clinic in one bowl. I start the day with a clean amount, and then as I use them, I just put them in my another bowl that's dirty, and so I don't have to go off and wash them in between sessions. So that makes it convenient. And you just wash them with hot water and soap. They are dishwasher durable. It's a cooking quality silicone, so they can be put in a dishwasher. They do over time, just so you know, full disclosure, they will yellow in about a year or two. It doesn't really degenerate the quality. So I have cups in my clinic that are a little bit older, and they're not as nice and clean as this looking, but you can still see through them. That's the other feature, is that you can see through and see how much pull you get. But they don't degenerate too much in terms of their function. So I've never actually had one wear out on me, but they've discolored it a little bit. Anyway, I hope that helps, and I know that you'll enjoy them in the clinic. So get a pair today, or get a set today. Not just one set, you'll need more, but you'll discover that yourself. And also the Blue Poppy oil makes a great companion to that. Okay, well, I'm going to show you now how easy it is to apply these silicone cups for both stationary cupping, and just to give you a little bit of an idea on how they can be used for moving cupping. So again, as I demonstrated before, 2 fingers underneath, thumb on top, and you just plunk it down and apply it. Simple as that. Plunk it down and apply it, and you see there's a little divot in there. You know you've got the strongest suction, and this little exercise will allow us to see that each cup, now I'm going to use 2 hands because it's a little bit of a bigger cup, and it allows me to get a stronger pull. And in this case, I've got a very strong pull. So very quickly, I've applied 8 cups, no pump, no glass flame, boom, it's done. And now I can leave them there and you can see how quickly the blood is moving in through the different layers of fascia, and it works very quickly. And I'm going to just take them off, and you can see the degrees of pull. So keep that in mind when you want to work tissue, the degrees of pull. Very quick, very easily. Now for moving cupping, as I was saying, you can sort of work the tissues very easily. Because you can morph the cup like this cup now becomes very easily suitable for a lot of different areas. And because it has the strongest pull, you're actually able to lift a lot of layers of fascia and connective tissue muscle up. So I'll just quickly show you that. I'm going to apply a little bit of oil. And again, you can apply it easily by squeezing the 2 edges together, or you can apply it stronger by pushing. But here's what you can do, is you can work the tissue up and down along the erector spinalis, and then you can twist it, and see how I'm morphing it like this, I'm able to get it along this edge of the supraspinatus and infraspinatus, the spinous border of the scapula here. And I can work it down over the deltoid. Super strong pull. And then I can even pull it up along the neck, along the levator scapulae. Lose pressure, apply again. And I can take it up into these areas and get a super strong pull. Trapezius, left scap, rhomboid, and so on. So don't think of this one just for the IT band or for hip releases. It can be used in a lot of innovative ways. So hope that helps, and have fun with the silicone cups.